There we go. Hi, everybody. It's Dr. Betsy Greenleaf, and we're another week of a Thursday where we have our lunch and learn. Dr. Dan is on his way. He's stuck in traffic. If anybody has ever lived in the New Jersey area, you know that traffic can be tough around here. So you're stuck with me until we got Dr. Dan that'll be joining us in a little while. I wanted to talk a little bit today about the coronavirus vaccine because I know that, I kind of a little hesitant to bring up the V word because I know the word vaccine really gets some people really riled up. And, I am not here to convince you to get a vaccine if you're anti vaccines. I'm not here to convince anybody to my opinion about them. And I know there are people that have very, very strong opinions about the idea of vaccines. A little bit just about the idea of the process of a vaccine. I will go a little bit over the history of that. And so, this dates back years and years ago when they realized that if you expose the body to a small amount of an illness, that your body would develop chemicals to fight off that illness. And it really started, and I'm sure the history goes even further back than this, but the one that comes to mind is really more with smallpox, that actually exposing yourself to a little bit of the smallpox actually helped with developing an immunity against those things. Because our body's smart. Our body's smart in that when we're exposed to things that are not good, whether that's viruses, bacteria, illnesses, you will develop what's called antibodies so that the next time your body encounters that, it goes, hey, this is something that's not great for me. Let me fight it off. And, we'll develop these blood cells that will go and fight that offending agent. So really the theory of a vaccine is to use that process, the body's natural ability to fight off disease, and to just kind of trigger it specifically against different specifically about different substances, and that's where they have developed these other vaccines from anything from, diphtheria and pertussis and chickenpox. When I was a kid, we didn't have a chickenpox vaccine. What you did was, you wanted to get immune to chickenpox, you all went over the person's house, where if a kid had chickenpox, you all went over to that person's house to try to expose yourself to it and hopefully get it while you're young, because the idea of chickenpox is that it can be a lot worse as we age. And I will tell you from personal experience, even though my parents did that, I even remember my sister having chickenpox and I was stuck having to stay with her because my parents really wanted me to get it. I wasn't allowed to go anywhere. I had to stay close to her. And, I grew up and people thought like, oh, you just might have had a mild case and we never knew about it. Well, wouldn't you know, I got chickenpox not even like, I think it was like a week before I started medical school. And as an adult, that can be really quite painful. There are risks that it can affect your nerves and also even fertility issues. So, chickenpox, I will tell you, that's definitely one of those things where I'm glad that there are, ways to keep people safer nowadays. But I know there's a lot of politics behind the idea of vaccines. And personally, I wasn't quite sure if I was going to get the coronavirus vaccine because I was a little nervous. So even though I believe in the process of a vaccine, I was a little nervous about something being so new and being rushed through the FDA. As much as sometimes we badmouth the FDA about things that are not available in our country, I really have to say that I am glad that they do their due diligence and take their time to inspect things that are out there before they let them come to market. I know there's also politics behind that, and people have strong opinions about that, but going back specifically with this vaccine, like I said, I wasn't quite sure if I was going to take it, and because of being so new, and I was a little nervous, and so I waited. And then what really changed my mind was an article by Alan Christensen. And what I really appreciated with Dr. Alan Christensen is that as a naturopath, he, I expected naturopaths to kind of be not for this for a vaccine, but he wrote a very pro article. And what it really did for me was it spelled out what are the risks of the virus versus what are the risks of the vaccine. And in comparison, I was really impressed with some of the data. I'm going to actually look it up so I can quote some of it right now for you. But everybody brings up the idea of sometimes with some of the vaccines that are out there with people, potentially the risk of death. The unfortunate thing is nothing in life is 100%. And there is risk in everything we do, and that we have to really kind of balance out what the risks and benefits are. Yes, with any vaccine, there is a risk of death. There definitely is. And we are, as humans, our brains are designed to scan for danger. So if you are in the mindset that you are nervous about treatment or this vaccine, your brain is going to be scanning for danger, and you're going to hear of those stories where something bad happened. But the majority of the time, people do fine. The idea that our brain scans for danger is this idea that we're doing it to try to protect ourselves. So, you always hear the bad news. You always focus in on bad things that are happening in the world, because that's what your brain is doing. It's looking for to keep itself safe, where we don't hear about the good news. We don't hear about the good stories. So, that's one of the things that you want to think about when you're researching this. Like, what's your mindset and what is being reported, because that's the other thing. The news and journalists, I'm not bad mouthing them, but they understand the psychology of the brain searching for things that are a threat, and they use that to promote their stories, because obviously if the more people that watch or listen or read, the more they're selling their news, the more their channel or outlet does well. And so these are the things that ends up happening. So you also have to understand your source of news. So, and you know what? Dr. Dan is texting me that he did not get the link he just got into his office. I'm going to recheck, send him the link here, and then we will get him in so you don't have to hear me blabbering for all day long. But let's go send that to him. Sorry for the delays today. We were trying to keep this timely, because we like to be able to do this for you every Thursday. And I love the fact, you see me with my readers here. The moment I turned 40, my eyes started going south. So that's a condition we could talk about another time, called presbyopia. But all right, going back to Dr. Alan Christensen, and I will put the link in here. I will post the link on Facebook of his article. But basically, like I said, what they did was he compared the side effects of the actual virus versus the vaccine versus placebo. Some of the people that are arguing about there's a risk of Bell's palsy with the vaccine. But what I want to point out is the risk of Bell's palsy with the vaccine is not any higher than the risk of Bell's palsy within the general population. And so Bell's palsy is a condition where you get like a facial droop, the facial nerves get affected and you get this facial droop. So that's the other thing that we have to take into consideration when you actually look at the data, is things that people may be reporting with the vaccine would have happened anyway despite the vaccine, because of the incidence of these conditions just within the general population. So going back with Dr. Alan Christensen's article, they looked at, for example, like side effects, look at the risk of fever. So and these were out of 10,000 people, these numbers. So out of 10,000 people, the risk of fever with actually getting the coronavirus, that's about 7,000 people with that. With people getting the vaccine, it's about 1,900. And with placebo is 2. So you definitely, getting a fever is very common after getting the vaccine. Feeling fatigued, that's maybe something that's very high. Also, those having the virus have about 6,000 patients experience fatigue, about 5,000 from the vaccine, and about 650 with placebo alone. So these are things that we normally expect when we see with any vaccine, is fever, fatigue, muscle aches, because of your body is developing an immune. Oh, hey, Dr. Dan, there you are.
Here I am. I'm just
Are you still stuck in traffic?
No, I just got to the office, and by the time I get into the office, Dr. Greenleaf, and by the time I get settled and get my computer up and sparked, it would probably be about 12:30. So I'm sitting here in the parking lot, and I'm committed, and I don't want to miss the discussion today. So I am here, and I am ready to talk. And I did hear a little bit about what you were talking about. You're talking about that vaccine, and you were talking about some of the symptoms and so forth that are associated with the vaccine. I was talking to multiple people about this last night regarding the vaccination, and they're trying to roll it out here in Monmouth County, as you very well know. And things have been somewhat slow, but it's always good to keep that strong immune system going, and I'm sure we'll get into that in a little bit. So here I am sitting in my parking lot.
I love it. Yeah, I was talking a little bit about Alan Christensen's article about, and I said I'll put that in our Facebook so that people can go read themselves. And certainly, I know that the word vaccine is a hot topic, and sometimes that really, I should probably give a trigger warning before we start this. That
Right.
Because I know how enraged some people become over that word, and I'm really just wanted to talk about my experience with it, right, and why I decided to do it. And that, the risks that we were seeing, I mean, when you look at Dr. Alan Christensen's article, and he compared the symptoms of COVID versus vaccine versus placebo, the highest symptoms we tend to see are fever, fatigue, muscle aches. And sure, though you see those not only with coronavirus, and you see those levels high in the vaccine group above that of the placebo, but we kind of expect those with any vaccine. What really triggered me when I was looking at the data was, more of the issues, the more serious issues versus the vaccine. And for example, and this was out of 10,000 people, when you looked at the number of ICU admissions, you had, at the time that this was published, you had 200 plus people that were in out of 10,000 that were admitted to the ICU due to coronavirus, where there was only one person who received the vaccine that had an allergic reaction that required them to stay in the ICU. And of course, nobody in the placebo group had any issues. But then you look at the number of people who had a stroke, and it was between 250 to 500 out of 10,000 in the COVID group, none in the vaccinated group or the placebo group.
Mm-hmm.
And I think more important was long-term symptoms, that they saw about 6,000 in the COVID group, none in the group of vaccinated or placebo.
Mm-hmm.
And then additional COVID infections from transmission to others. Obviously, if you're getting a vaccine, the question is you're not going to be transmitting because you're not, but they expect that if you have COVID, that the rates they were looking at in this study specifically was between 20,000 to 30,000
Right.
out of 10,000. That was like they were like higher numbers
Right.
um, with transmission. So it was nice to see an article by somebody who tended to be more on the natural side,
Mm-hmm.
explaining it. And like I said, for me, it was a personal decision to actually become vaccinated.
Right.
So,
And I think that's important to note, Dr. Greenleaf, is because it is a personal decision on what to do and what not to do with that. So there are those who want to be vaccinated, and there are those who don't want to be vaccinated, and it becomes a personal decision. And in any bad season, you have to make sure you follow the guidelines like we do in the office, right? Washing your hands and not touching your face and things of that nature that are important because that would spread. That's how these viruses spread. That's the
yes,
transmission. And you have to be, smart about it. And I remember during H1N1 in 2008 and 2009,
I got
Dr.
that one too. And I had to
You know
get out
what?
of the state.
I didn't, I was fortunate enough not to get that one, but my son was just born at that time. And I remember saying to my wife, in the office, what we did is we wore scrubs. And then, everybody had their own personal office. And we would get the scrubs and we would put them into a big green, garbage bag type of a situation. And then we had, our jeans or we had sweats that we drove home in. And then from there, I took a shower when I got home. Of course, I was washing my hands in between each patient that I saw, and I could tell you that we had lotion all over the place at that time, right? And so I hear the pooch. It's all good.
I know. I apologize that I realize he's barking in the background.
No, you know what? It's real and it's raw, so that's what makes it really good. So, if I were at the home office today, my 12-pound cockapoo has a tendency to jump up on my desk at the home office. But those are the things that you figure out to do to help yourself out. So I was fortunate enough. I came out unscathed during that time. And it was, I thought we were going to get it. We weren't wearing masks back then, right? That's not one that we wore masks, but we definitely, we washed our hands and, we definitely took different types of precautions, as we are here. And it's a personal decision, and that's okay. I do remember texting you, I think the second day after after you got the vaccine, there was no
Oh, the second one was a doozy. And I'm hearing a lot of different stories about how people are reacting to it. I got the Moderna one and I was fine with the first one. And this is all personal experience, but the second one, within exactly 12 hours later, I felt like I was hit by a truck. I had muscle aches. My skin hurt. If anything touched my hair hurt. I had a fever. I was nauseous. I had the chills. I had the sweats. And I knew that from listening to other people who had received this, that they had said that, some people said that they had similar responses and that it went away within 24 hours. But man, it was probably the longest 24 hours of my life.
had,
I
right.
was like, is this ever going to end? And then I woke up the next day and felt perfectly fine. But what I would recommend for people is that you may want to take off the next day or clear your schedule for the next day or two, because you may not know how you react. Now, My in-laws got their second vaccine this weekend, and apparently they didn't have any symptoms.
Everybody's different.
So my husband got his first vaccine. Now he got a different one. He got Pfizer. And 2 days later, he ended up with fevers, chills, muscle aches, to the point where we actually were worried that he may actually have coronavirus. So I sent off a nasal swab to check, and it was fine. So, it's just with any vaccine, we kind of expect there to be some, aches, pains, fever. Those all can be normal.
Right. That is a very normal situation. And when you said my hair hurt, right? I mean, if I contract the flu, when I remember, if that happens, I do feel as if my hair hurts. That's one of the symptoms. And I do remember texting you the second day, and I didn't receive a response for 3 other days beyond that. So I was like, oh, uh-oh.
Like, are you still alive?
Is the buy sells agreement signed already, right?
I know. Oh my goodness. But
So,
and I know it is very frustrating. In here in New Jersey, I know all the states are doing it differently. I know that there are people that do want it and are having a hard time finding it and getting it. I think it's being rolled out in so many different ways. I can only speak specifically for New Jersey, that you go to the website, if I said, I'm not here to convince anybody. If you're anti-vaccine, then don't listen to us talking today. Tune us out. But if you are interested in it, I would recommend go to the New Jersey website, make sure you're registered. And then just being registered is not enough, especially if you're on one of those high risk health groups. Or if you're on the older side, you want to make sure there's a list of places that have the vaccine. Make sure you're calling them, make sure you're contacting them, because sometimes it's just luck. The other thing is, they are my parents were doing that every day and still could not find a place to get theirs. Right. And then just this week they were contacted, because they had registered, they were contacted hey, we have an appointment available for you. Right. So, and I think the biggest thing is, I'm hearing stories of people that have been vaccinated that they're like, oh, I got the vaccine, I'm good. I don't have to wash my hands or wear a mask anymore. That's unfortunately not the way it works, because we don't really know we don't really know your response to the vaccine. And we know same thing with the flu vaccine. Just because you got the flu vaccine doesn't mean you're not going to get the flu. It's just that if you get it, maybe you'll have a more mild case. So you still need to do the things to protect yourself and those around you.
Right. Still continue to follow guidelines and federal, state, local, they are there for a certain reason. And please make sure that you follow those guidelines, And, as I said, I think the big issue is washing your hands, and stop putting your hands on your face. I think everybody is in agreement on that, Dr. Greenleaf.
It's interesting because apparently I saw a documentary once it was on things that we do as humans that we do subconsciously. And one of the things that they showed was when you shake a hand, people are, first of all, I don't think anybody's shaking anyone's hand right nowadays, but when you do shake a hand, people didn't realize subconsciously that within a few minutes of shaking someone's hand, you're more likely to touch your face. And they don't know why we do that as humans, but there was a study that showed this. So it's you really have to make a conscious effort. I know my kids drive me insane because if and when we do go out in public, they're wearing masks, great, but they're touching things and touching their masks, and I'm like, do not touch your face. Do not touch your face.
They're kids. My son does the same. It's tough. After he plays hockey, one of the first things that we have, if he plays a game or if he comes back for practice, one of the first issues is that, wash your hands. I mean, ordinarily you should be doing that anyway. That's just good hygiene regardless. Now, my son did ask me, in my days in junior high school and high school, did I do that? And I said yes because because I want him to do that. You know, but then there's something to be said also. I mean, I remember in high school and football, you had your practice jersey. Uh, Dr. Greenleaf, I don't think that thing was washed once during the entire season. It stood in the corner on its own, by the way. And but then, that's another way to help build up the immune system is rolling around in the mud, the dirt, the
Yes.
grass. I mean, that's also important, in addition to so I did in fact do that. And there was, that white practice jersey was multiple colors. And when I brought it home at the end of the season, my mother threw it out. She said, "We're not even
Not
attempting
even
to
worth.
watch this."
And that's another thing is, and we don't have time to get into it today, but just the idea of immunity in general, because like, coronavirus is a hot subject, but how many other, bacteria, viruses,
Hmm.
parasites, yeasts are out there that we're being exposed to every day, and just doing things to support our own immune system is really where
Right.
we should be focusing on. And gut health. And we always go back to gut health. It plays such a big role in
Sure
this
does.
because, I was looking at anywhere from 50 to 80% looking at this, whatever study you look at of your immune system is made within your gut. And,
Right.
that traditional American diet, we as Americans do
Right.
not have healthy guts, and therefore we do not have healthy immune systems.
Right. And they are deprived. And you know what? I want to add in too, because one of the students asked me this same question. You know, is it only in America? And I said, you know what? I've read a lot of research over the years where, if you look at other countries, for example, Western Europe, they're into smoking a lot. They're heavy smokers, which helps decrease the immune system too. So it seems like there are habits, and there are these poor habits that individuals have that can create somebody to have a poor immune response. And one of the issues that you and I have discussed is that coming out of this pandemic, when it's over, those individuals that have gained weight, that have not been able to get out and exercise, they're, I don't want to use the cliche, but kind of behind the eight ball, if you will. And, it's very difficult. And there's this COVID fatigue out there. And I've been talking about this a lot lately, where, patients, in discussing with them, they're afraid to go out, and they haven't been out, and it's very difficult. And, listen, if you want to wear a mask, that is a personal decision, right? But it's mandated. I mean, if you're in the park, you're getting a little vitamin D. It's nice out today. It's going to be 50 degrees here in New Jersey. Get a little exercise, maybe get out for 20 minutes. And if you can get out for even for 10, 15 minutes, it's good for your body, mind, and soul, if you will, right?
And interesting enough, so we're wrapping up February, which is Heart Health Month, and
Yes.
even though coronavirus is on the top of everybody's mind, heart disease is still the number one killer,
Right.
and more so during this coronavirus because people were getting heart symptoms and scared to go to the hospital.
Right.
But where I'm connecting this to is that the risks for heart disease are also going to add to those risks of having issues with your immune system, and
Right.
therefore make you at higher risk for coronavirus. And if you have heart disease and get coronavirus, that's like a double whammy.
Right.
So things that like one of the risk factors for heart disease is diabetes.
Hmm.
And there's so much, especially things that you can do with your nutrition
Right.
skills. But then also this, they're saying now this hidden epidemic of like being sedentary. So not
Yes.
exercising,
Right.
poor diet, poor sleep, alcohol. So, what were people all doing during the coronavirus? They're eating comfort foods. They're probably drinking more. They're gaining
Right.
weight. They're not Oh yeah, obesity. I forgot to mention obesity in there. They're,
Right.
gaining weight and they're sitting around watching Netflix, binge watching Netflix. And so, first of all, you're not doing yourself any favors when it comes to your immune system and your general health. But now you're also putting yourself at higher risk for
Right.
heart disease and coronavirus.
Right.
So,
Right.
so
And it's important. It's important what you just mentioned. Patient in the office, and he was saying to me that, for the first month of the pandemic, binged on Netflix, and, gentleman that's in shape, physically fit, and then, in speaking with him, I said, you have a whole gym in your basement. Use that, utilize that. So if you have a Peloton, even if you have, we have a simple treadmill in the basement, nothing elaborate, right? If you have something like that, get on that. If you don't, right? If you don't, just going from the first floor to the second floor, go up and down the stairs, right, Dr. Greenleaf?
walk around the neighborhood.
Right,
I had this such a, I'm working on this myself. I have such a mental block against exercise, and the encouragement is not to use the word exercise, use the word movement. And I would, there are honestly some days where I'm like, I'm in my nice, it's been cold, I'm wearing my nice warm Uggs and my nice, comfy clothes, and I was like, oh, I don't want to change into clothes to work out. You know what? And then one day I was like, this is ridiculous. Who says I need to be wearing workout clothes to add more movement into my life? And, so I just started doing things here around the house. I mean, even if it was, you said walking up and down the stairs. I mean, I have weights, but you don't necessarily have to have weights. Get soup cans and use your soup cans as weights and do repetitions with that. So just, run in place, jump up and
you
down.
can you can take you can go for a walk,
Yeah.
right?
So there's
It's
so
simple.
many.
There's always something that you can in the house.
And you don't need to,
I think I'm losing connectivity here in the parking lot, Dr. Greenleaf.
yeah. Well, we're coming up to the end of a half an hour, and I know you and I can actually end up talking for hours if you let us go on. But I know you got to get into the office, and I guess we'll see people back here next week. But if you're interested in getting more information about how to boost your immune system, you can come join us. Here's some announcements I want to make. Number one, our website is getting a complete overhaul. So if you go to our website and it doesn't look like Greenleaf Health and Wellness, give us a little bit. It's getting a full upgrade. The other thing is we've added some. Yeah, Dan, and I'm springing this on you, Dr. Dan, because I didn't tell you this one yet.
Okay. Oh, okay. It's all good.
But I realize that some people may be a little bit reluctant to make that commitment for that first appointment. So we have added discovery sessions where you can, for $59, book a discovery session with us. We will do a telehealth visit where you tell us, it's a half-hour discovery session. You tell us what your concerns are. We can, any of the practitioners at our practice can then spend the time to explain to you what we do, how we do it, what you can expect. And then you can discover and decide if we're the right fit. If for some reason that maybe we're not the right fit, because, for every person there is another person, and not every doctor or practitioner is going to necessarily mesh with your personality, or vice versa. So, if for some reason we cannot offer something that you're looking for, then we will definitely give you referrals and references of other places where you can seek help. So either way, you're benefiting, because you're either going to be coming to us or we're going to find somebody that can help you out, and you don't have to do that work. It looks like we lost Dr. Dan, but the other thing is, if you do the discovery call with us and you decide to stay with us, the price of your discovery call will be taken off the price of any of your next visits or packages. So that's something that we're offering now that I think is going to make things much better, because I know a lot of people have questions and concerns before they, make that commitment to join a practice. So you can find that on our website. Like I said, because of the website being down right now, you can actually go directly to our scheduling site, and I'll give you the code here, and I'll actually post it in the Facebook. But the code directly for the scheduling site, you can go look on Schedulicity, and look up Greenleaf Health and Wellness, or you can go directly to the link, which is www.schedulicity.com/scheduling /capital TPF7YJ. I will put that in on our Facebook, and also you can just go to the Schedulicity website or the Schedulicity computer. You can check that on Schedulicity, and Schedulicity is SCHEDULICITY.com until our website is, our new and improved website is up and running. And we, make sure you follow us on social media. Either Dr. Dan Cartalicchio is on social media, or Dr. Betsy Greenleaf. Follow us, because we post all sorts of information there during the week. Follow us on Facebook. Make sure you like and share any of the things that we're posting. Dr. Dan and I both individually have our own podcast that you can listen to, and you can find information on our social media about that. And, we'll see you again here next Thursday. All right. Have a great day. Stay well.